We know that there are lots of people suffering with neck pain, mid-back pain, low back pain. Sometimes that pain will stay in the neck or the low back, or sometimes it'll radiate out into the arms and legs or hands or feet. Nerve pain can show up in a number of different ways, but I want to show you a couple of the causes of nerve pain. So one, you could have a healthy spine, nice healthy disc here, nice healthy bone, and there could be an activity or a movement that causes this nerve to get irritated. And wherever this nerve goes to, the person will feel pain in the muscles or pain in that area in the body, or pain in or loss of or change in function of an area that this nerve goes to, like trouble with digestion or something like that. Now, this disc over time, if this joint stays stuck and doesn't get corrected, it can start to degenerate. So when a disc is moving, it's like a sponge under a sink. A lot of water goes in, a lot of water goes out. You make a wrong move, it's like a drop of soap going in. It gets sudsy, but if you keep it under the water and keep it moving, the body cleans up those suds and minimizes the damage or minimizes that stuck joint and that inflammation, which is mimicked by the soap actually coming out, so that eventually you're clearly pumping out clean water every time you move that sponge. Now, if the sponge gets stuck or continues to have inflammation, that's like constantly putting soap in the sponge and it never really getting back to clear water. It just keeps producing suds every time you're squeezing it. When things get stuck, it starts to move less and less. So all those suds start to stay in the sponge, in this case, stay in the disc, and eventually you can actually get like the sponge isn't under the water anymore. It gets so little bit of movement, it's almost more like a sponge that's on the side of the sink, and it becomes dry and brittle. So the first stage in loss of motion of a joint is that the disc can start to show signs of degeneration if it's not moving. One, major trauma, or when the spine starts to degenerate and becomes more vulnerable, repetitive movements can start to cause something called bulging, to where that jelly material that's on the inside can start to work out towards the edges. If that goes on, I'll try to find another disc, that can continue to go on in time and thin out the disc, and more of that can happen if we don't get motion restored to that joint. If there's a major trauma, or if you make a wrong move or in a wrong position, there is something where it goes from bulging into a herniation, where actually it comes through all the disc material and starts to go either in the spinal canal or in the hole that the nerve comes out of on the side. So those are the different things that the spine can do when it's injured. With chiropractic care, the object is to, as soon as possible, make sure all the joints are moving. If a joint gets stuck from injury, to restore motion to that joint as soon as possible, because once again, that starts restoring the joint back to as healthy as it's capable of being, getting it under that water again, squeezing that water in and out of the sponge, so to speak, or in and out of the disc, so to speak, so all the suds come out, or in this case, all the inflammation comes out. So whatever state that this spine is in, you want to get motion back in that joint to get that joint as healthy as possible. Not just because you want to keep the spine healthy, not just because you want it to move well, but equally or as important is because these power lines go down through the spine. The spine is the protector and pathway of life in our body. So the healthier we keep these joints, the less degeneration these joints get, the stronger and healthier they are to avoid herniation or any type of disc or spine injury, the better we're going to protect this nervous system that's constantly bringing life down to our body and constantly bringing information back to our brain so our body can heal and repair. So 2 reasons we're keeping the spine important. 1, to keep it healthy and keep it moving so we could be moving and active. And 2, to protect the brain and nervous system, the pathway of life to our body.